Hi everyone, welcome to chapter 4. This is prenatal development and birth. So it's kind of like having two different sections in one. So we'll kind of cover them in that way. So first, prenatal development. Some background information. So in the middle of a woman's menstrual cycle, excuse me, which can happen once every 28 days, every 35 days, 45 days, but the average, is somewhere around 30 days. The ovum is released into the fallopian tubes, and sometimes you have hyperovulation depending on the woman, which means you drop more than one egg. And again, that can lead in fraternal twins, which we'll talk about. And then every month, a woman's body is preparing its uterus for pregnancy. So that's why hormones are released. And once it realizes that you're not pregnant, it starts to shed the uterine lining. And we go through it every, like I said, somewhere between 28 to maybe 50 days, depending on the woman. Now, men, they have sperm. 300 million are typically developed per day, and 300 to 500 of them will reach the ovum. So again, the chances of getting pregnant, there are a lot of viable sperm, and they can live for up to 6 days. So we'll talk about, again, that process. But conception is usually considered during about a 3-day period from following intercourse. And that is the beginning of prenatal development. Now, the periods of prenatal development are not equal, but there are 3 different periods. The first being the germinal period, which includes the zygote. The second is the embryonic period, and the third is the fetal period. They each, and that actually goes in order of length. So the germinal period is the shortest, and the fetal period is the longest. Now, the germinal period lasts the first 14 days of prenatal development. This is many times before a woman even realizes she's pregnant, right? This is 2 weeks into development. So a zygote begins to develop within hours of conception. It's considered a blastocyst, which is a fluid-filled ball after about 4 days. And the outer layer starts to become the amnion and the placenta. The inner layer starts to become the actual developing organism. Now, after about 10 days, the zygote will implant itself into the uterine lining, and it's now creating its home, its environment for the remainder of the pregnancy. So again, the most important part of this germinal period is the fact that the organism is creating its environment for the duration of the pregnancy. Now, here's a little diagram of that. You can see at the bottom of the diagram, that's where the sperm will go through. They actually go all the way through the uterus, through the fallopian tube, and meet the egg within the fallopian tube. That's where fertilization takes place. And then again, it takes about 10 days for that zygote to make its way into the uterus and implant itself. Now, sometimes you'll have things called an ectopic pregnancy, which is when the zygote gets stuck in the fallopian tube. And unfortunately, we are not able to allow a developing organism there, and it results typically in having to terminate the pregnancy. Now, that outer layer I was talking about, the placenta, the umbilical cord. So here is a picture, and again, it's showing an embryo, which is the next period, but think of a zygote. We actually, for the first 8 weeks of development, have something called a yolk sac, and that is believed to deliver nutrients to the developing organism until the placenta is up and running. So the placenta takes about 8 weeks to get up and running. So you see the embryo, it's connected to the placenta through the umbilical cord. So, and then the placenta is connected to the mother. Now, again, through the placenta is where we bring in food and oxygen for the developing organism and actually carry away the organism's waste. But if you think about it, you do not necessarily have the same blood type as your mother. So this is a filtration system that will keep the mother's and the organism's blood separate. But again, it cannot filter everything. So we will talk about things like teratogens, which are harmful agents to the organism. So again, you have the organism, you have the placenta, which is the life support system. It needs the nutrients, and it's connected through the umbilical cord. Now, the embryonic period is a few more weeks, right? So the first period was about 2 weeks. This one's about 6 weeks. And this is when the foundation for all we need to be a human being is laid out. The nervous system, organs, muscles, skeleton, the heart begins to pump after a few weeks. The neural tube, which is the spinal cord and which will turn into the brain, is developing. And it just starts kind of out in the open. It's very, everything's, again, developing within the same time frame. As you can see, you can start to see that, okay, this may become a human, right? The eyes, the ears, the extremities. Slight movement is typically not yet felt by the mother. But again, this organism is laying down the foundation for everything it needs to grow into. Now, it will grow into everything next period, but this period is the period of making the plans. What will this organism become? All of that is being laid out at this time. Now, the fetal period is from the 9th week of pregnancy until the end. And again, we'll talk about the ending times. But it is the longest prenatal period. It is months in length. And during this time, the organism increases in size. It grows into all those earlier elements laid out in the embryonic period. Now, trimesters are 3 equal time periods. So from conception to about the 3rd month is the first trimester. From the 4th through the 6th month is the 2nd, and from the 7th month until the end of pregnancy is the 3rd trimester. So think about, when does each period begin? They actually all begin in the first trimester. The germinal period, the embryonic period, and the fetal period, which shows you how much change and growth is going on in a woman's uterus, which again makes sense of why they may have morning sickness and feel a little uneasy, especially in those first few months. So here's a little bit more detail. Again, around the 3rd month, you can typically tell the sex of the baby through an ultrasound. Heartbeat's starting to become strong. What's an important term here is age of viability. That is the earliest age an organism has been found to survive when they are born. So the earliest has been between 22 and 26 weeks. And again, it involves a lot of intervention by a doctor and by a team in order for that organism and that baby, when they're born, to survive. So again, if you think about a 40-week pregnancy, 38 weeks, I mean, that's about halfway through the pregnancy, which just shows how much growth still needs to happen. In the 3rd trimester, we see the expansion of lungs, maturation of a lot of different things, especially the brain and the lungs. And we start to actually see the organism developing preferences, and they've done that through different tests. Okay. So those were the 3 prenatal periods. You'll want to, again, know their length, what important element is going on each period, and any important terms. Now, I mentioned a term earlier, teratogens. That is a prenatal environmental influence. Now, a teratogen is any environmental agent, so we'll talk about a few different ones, that actually can cause damage during the prenatal period to both the mother, possibly, and the developing organism. How much damage depends on how much is being consumed, what is already hereditary going on with the mother and the organism. Are there any other agents that are, incorporated in that experience, and even the age of the mother? What we find is there's many times physical and psychological consequences from the use of teratogens or exposure to teratogens during the prenatal periods. Now, this diagram shows the three periods. First period of the zygote, the embryo, and the fetal, and shows the susceptibility to teratogens. Now, typically during the first 2 weeks, again, if you maybe had one glass of wine or something, it probably would not result in damage to the organism. But if it's extreme use or other things going on, again, that could lead to a termination of the pregnancy. Notice all of the elements that could be influenced during the embryonic period. The nervous system, the eye, the heart, the teeth, the legs, the palate, genitals. I mean, it's very susceptible to teratogens. So if I were to say which period is the most susceptible to damage from teratogens, it's the embryonic period when all the foundation of our body parts is being laid out. That fetal period, though, can still have damage. So the earlier we stop exposure to a teratogen, the better. Because again, the brain is still developing. There can be psychological defects, to an organism still within that fetal period. Now, there's many types of teratogens. I just decided to highlight a few here. So the ones in red, alcohol, environmental pollution, and infectious maternal disease. But we don't want to forget about things like prescription and non-prescription drugs. Again, there's a lot of prescription drugs out there. You think of things like Oxycontin and Norco and things that could really affect a developing organism. What about non-prescription drugs like I just totally blanked. Okay, no, caffeine, right? That is also seen to be damaging. Illegal drugs, there's so many different types, right? Tobacco. So I'm going to focus on alcohol and, like I said, a few more to just highlight within this section. So with alcohol, the danger is the organism developing fetal alcohol syndrome, which would then, when they're born, really affect their development. It causes physical, mental, and behavioral outcomes, and they find 3 diagnoses that vary in severity. Again, many times it depends on how much was consumed, what is already the organism's susceptibility. So fetal alcohol syndrome is considered the most severe, and then alcohol-related neurodevelopmental disorder is the least severe of fetal alcohol spectrum disorder. Now here's a nice little chart that kind of breaks it down for us. Again, there's facial abnormalities that may or may not be present, and brain injury. So fetal alcohol syndrome kind of has everything, whereas ARND may only have a few of the elements. Now, what are the outcomes for children? Again, when they're born, some of the major outcomes you'll start to see is prematurity, low birth weight, and again, many times other type of developmental issues that we may not even know about until they start to emerge. What about the effects of environmental pollution? They say now, many babies are just born polluted, depending on where they live and what they're exposed to. There are more than 75,000 chemicals that are commonly used. So again, the chances of being polluted is high. Now again, there's impairments that may occur, chances of life-threatening diseases. If any of you have maybe seen the Erin Brockovich movie with, again, I can't remember, Julia Roberts, she helped a law team because a whole community became very ill from the water that was being told to them was safe. Now, I know we've heard similar stories come up recently, right? Like, how about lead in Michigan? There was a major thing a few years ago where they switched the source of water, and this led to lead being leaked into their water system. Again, they told the communities at first that the water was safe. Then they told them if they boiled it was safe. And now to come to find out it was not. And none of that actually worked. So what's going to end up happening is there will be long-term consequences for these children specifically who were born in this time when they were being exposed to lead. Look at all the different effects to a child's health. Brain injury, issues with attention, ADHD, hearing loss, hyperirritability, issues with their blood, with their stomach, with their bones, reproductive issues, heart. Again, we don't always know, and it depends on your own biology how you might be affected by something like an environmental toxin such as lead. Okay. And then infectious maternal disease. Maybe some of you remember the Zika virus that, again, had unfortunately become popular not too long ago. And that was because not only was it a virus, something we, again, didn't see too often, but it was leading to babies being born with microcephaly, where their head was very small compared to other children born with a typical size head. So again, we have to be very careful about teratogens. So that's why prenatal health care is so important. Things may come up that have not come up before, like diabetes and toxemia. So, but there's also reasons why women may delay prenatal care, such as financial hardship, other barriers. Again, if the pregnancy is not something that they want to share, it becomes difficult maybe for them to get the care that they need. Expectant mothers with late or no prenatal care, broken down by different ethnicities. And you could see again that biggest age group is typically adolescents who are maybe trying to keep it a secret for multiple reasons. All right, second part of our chapter, thank you guys for bearing with me, is birth. Now, the way we've approached childbirth has changed over time. Before the 1800s, we were having home births, right? That's where you see in the movies, they're yelling for boiled water and sheets, and again, they're trying to sanitize as best they can. But after the Industrial Revolution, it was a push for women to give birth in hospitals. Then, kind of during the hippie movement, there was a movement towards more natural childbirth. You know, things like Lamaze start to become popular, different breathing techniques. And today, there's even specific birthing centers you could go to that just are designed for helping mothers and families through that birthing process. But there also are some home births. I have family and friends who have given birth in a tub at their home. So again, nowadays there's lots of different options out there depending on what you personally feel comfortable with. The 3 stages of labor, I don't know if anyone's actually thought about this before, but stage 1 is dilation and effacement of the cervix. Remember, we're hearing, is she 5 centimeters dilated? She needs to be 10 centimeters dilated to start stage 2, which is the pushing. Once the baby's head pops out, that is part of stage 2 and the birth of the actual baby. Stage 3 then is birth or delivery of the placenta. Remember, the placenta is connected to the mother, and through the mother is coming the nutrients to the organism. Well, now it's time to also deliver the placenta. C-sections or cesarean deliveries were rare years ago, but now they're very common. Again, if you've had a previous C-section, you're more than likely to be signed up for another one. If you've had any kind of medical concerns, babies in the wrong position, infection, you know, there's a lot of reasons why a C-section may be warranted. And again, it's only supposed to be warranted for case of emergency. Newborn babies, when they're born, are assessed based on different elements. So number 1, they're born to adapt. You think about a baby who, again, goes through stage 2 of birth, and the head has to change shape, the shoulders. They're equipped to withstand that trauma of going from that fluid-filled environment with that amniotic fluid surrounding the organism to now being out in the light and the oxygen, right? We're also going to look at the appearance of the newborn baby. Now, at this age, the head is very large compared to the rest of the body, but we're going to be looking at color and things like that, and specifically assessing by the APGAR scale. So APGAR stands for appearance, pulse, grimace, activity, and respiration. Now, it's on a scale of 0 to 10 when a baby receives their APGAR score. Now, you see those 5 areas on the side: heart rate, respiratory effort, breathing. Reflexes, do they respond to touch, muscle tone, and overall color? And 0 is basically non-existent, 2s are strong, and 1 are kind of weak. So depending on the score the child gets depends on what maybe issues need to be addressed. Now, again, a good physical condition is typically a score of 7 and above. Sometimes they can assess at maybe the 1 minute mark and then again at the 5 minute mark, and many infants improve during that time. If you need assistance with breathing or the other vitals, that's probably a score of 4 to 6. And emergency medical attention would be 3 or below, because again, there's 5 areas there. So that means at least 2 of them have received scores of 0, which is extremely dangerous. The prenatal environment. So we're going to talk about, again, when babies are born, what about prematurity and low birth weight? Well, when babies are born with low birth weight, they have a greater chance of different health issues like heart disease and diabetes. If they have a high birth weight, they actually have a greater chance of cancer and all different types of cancer. So again, they find this link between when we're born and things that happen to us later on in life. Now, prematurity takes 2 things into account. If you're low birth weight, that's considered premature. And if you're preterm, that's also considered premature. So you could be both or one or the other. So what is premature or preterm? Preterm is born 3 weeks or more before the end of a 38-week pregnancy. So preterm would be considered less than 35 weeks. Low birth weight is considered less than 5.5 pounds. So what happens many times with children who are born low birth weight, as you can see, many different issues: illnesses, attention issues, language delay, other difficulties in school. And again, this is not for sure, this does not happen necessarily to 100% of children, but they, through research, have found that this many times occurs. Preterm infants, again, they may be small, but they may still be appropriate. But what's a concern is small for date infants, when they're supposed to be born at 38 weeks and you've tracked it, but their appearance appears very small compared to a 38-week birth. So they tend to have more issues. All right, please email me if you have any questions.